Hi, my name is Heidi Schutz, and I will be presenting the clinical case study for LC for APN 505. A general patient overview. LC is a 32-year-old female who's an English archaeologist and treasure hunter. She is vegan, denies tobacco or alcohol use, and she is single. She's reported a 3-month history of abdominal distension, a 16-pound weight loss with nausea, worsening epigastric pain, poor appetite, and onset vomiting. She was evaluated by a village clinic while on site and was prescribed antacids with no relief. 5 days after that, she developed headaches, cough, diarrhea, night sweats, a rash on the bilateral extremities, and malaise. After that, she's then flown to Texas for further evaluation and management. Here she developed hypotension and pulmonary edema, is admitted to the ICU, where she's put on mechanical ventilation and put on total parenteral nutrition. Imaging does reveal that she is positive for Ascaris roundworms. At that point, she does have a surgical resection of both a full duodenum and the proximal jejunum. Enteral feeding is initiated on day 4 post-operatively, and she is currently awaiting a bowel transplant 1 month from now at the Cleveland Clinic. Primary diagnosis was the hantavirus pulmonary syndrome, valley fever, small bowel obstruction, secondary to roundworm infection. Secondary diagnosis is a profound protein calorie malnutrition and disseminated intravascular coagulation. Some basic anthropometrics about LC. She's 175 centimeters. Her admit weight was 53.6 kilograms. Her BMI is 17.4, and her usual body weight is 61 kilograms. Some pertinent medical history about LC. She is a type 1 diabetic. She's had an acute pancreatitis secondary to trauma. She's vitamin B12 deficient. She also has Crohn's that was diagnosed in her early 20s, and she does have hyperthyroidism. Pertinent surgical history includes a history of terminal ileal resection that was secondary to Crohn's, and unfortunately her family history is unknown due to the fact that both of her parents are deceased. The pertinent clinical labs that are not within normal limits are listed here. Her BUN was 31 milligrams per deciliter. Her creatinine clearance was also abnormal. Potassium, liver enzymes, ALP, and AST were also outside of normal range. Her albumin, white blood cell count, hemoglobin, and vitamin D were also abnormal. In addition, regular CBC, CMP, liver function enzyme tests were also performed. Current medications LC is on is Vyvanse, levothyroxine, vitamin B12, Cimzia, multivitamin and mineral supplement, and vitamin D, 5,000 international units a day. Associated diagnoses are listed with each medication as well as the duration of time. During her hospital stay, Elsie was prescribed a couple additional meds, such as the antiparasitic ivermectin, omeprazole, loperamide, cholecystramine, magnesium oxide, famotidine, and 50,000 international units of vitamin D weekly for at least 8 weeks. Her nutrition clinical course throughout her hospitalization is as follows. She was put on enteral feedings, specifically Gevity, at 1620 kcal, 68 grams of protein, and 816 cc's of free fluid. Recommended 34 cc's of water were for 24 hours straight, and an increase in her protein intake due to the stage 3 pressure ulcer on her coccyx. The patient summary is as follows. Elsie is a 32-year-old female with a 3-month history of abdominal distension, poor appetite, 16-pound weight loss, nausea, epigastric pain, and vomiting, admitted with a new 5-day onset of hypotension and pulmonary edema. After mechanical ventilation, the patient is put on TPN. Imaging revealed a SBO secondary to roundworm infection, the entire duodenum, and 22 centimeters of the proximal portion of the jejunum is resected. Day 4, post-operatively, patient recovered with full bowel function and Gevity at 1.5 calories with 45 cc's per hour for 24 hours is initiated. Protein intake is being increased due to that stage 3 pressure ulcer on the coccyx. Patient is scheduled for a 1-month follow-up for a complete bowel transplant at the Cleveland Clinic. Primary diagnosis is the hantavirus pulmonary syndrome, valley fever, small bowel obstruction, secondary to Ascaris, and secondary diagnosis of profound protein calorie malnutrition. Significant past medical history includes type 1 diabetes, Crohn's, acute pancreatitis, hyperthyroidism, vitamin D deficiency, a pelvic fracture, and terminal ileal resection with family history unknown. Primary focus will be on the diagnosis of the hantavirus pulmonary syndrome. Two PES statements were made. Number one being altered GI function related to decreased functional intestinal length, as evidenced by recent small intestine resection. Second PES statement, protein calorie malnutrition related to acute disease and coccyx stage 3 pressure ulcer, as evidenced by decreased albumin and increased creatinine levels. Nutritional implications for the patient are as follows. Due to both the ileum and duodenum being resected, she is at an increased risk for malabsorption of bile salts, reduced electrolyte and fluid reabsorption, as well as vitamin malabsorption, specifically calcium, magnesium, and zinc. Protein malnutrition is also of concern, especially because of her low BMI from the beginning at admit. Her post-enteral feeding and surgery as well put her at risk, and looking at her pre-albumin and her albumin levels can help monitor and assess further progress. Other vitamin deficiencies, specifically A, D, and K. Fluid volume status will be monitored during her hospitalization. Specifically of note will be the electrolytes, the glucose, the BUN, and the creatinine levels. LC-specific BUN and creatinine were abnormal, so that will be further monitored. As it relates to the patient's overall bodily systems, beginning with her circulatory system, again, focusing on that primary diagnosis, we're going to talk about how that impacts the body. So basically that hantavirus pulmonary syndrome and the valley fever are types of viral infections, in which case that immune system is going to mount a response. If you look to the right, the graph there kind of delineates all the associated cells that are going to react when there is trouble within the body. T cells specifically are a type of lymphocyte that are recruited. They do target viruses specifically. Eosinophils as well, as you can see, they are made to go after those parasites. Two of those will specifically begin once that invader is found in the body. Due to the hantavirus pulmonary syndrome, she does develop that hypotension and pulmonary edema. So again, picture of the heart and lungs there, as you can see below. Both of these organ systems will be impacted. A decrease in her overall serum albumin and a rise in the hematocrit will possibly show us that fluid shift to the lungs. So moving on, again, just rounding everything back out to the focusing on that primary diagnoses. Moving on to the lymphatic and integumentary system. So again, once that foreign invader is found, innate and adaptive immune responses will begin. Elsie did present with some fever, some cough. She had that rash on the bilateral extremities, indicating inflammation going on in the skin there, starting that cascade process. The skin is one of our primary physical barriers towards the environment. And once there is some kind of foreign invader detected, that skin is going to our body's going to generate excessive amounts of heat, aka fever, to try and make that environment as inhospitable for that foreign invader to try to get rid of it. So that begins, and you can see this graph here depicts that nicely. Again, those appropriate white blood cells will respond, going back to that elevation of body temperature. All of that is part of the lymphatic and integumentary response. The digestive system will most certainly be impacted. So she did, for her secondary diagnosis, had that small bowel obstruction. So any kind of blockage in that small intestine is certainly going to interfere with nutrient absorption. It's going to slow down digestion. She'll present with nausea, abdominal distension, pain, and bloating. Due to the fact that she's actually had 2 parts of that small intestine removed or resected, that's very much so going to impact the digestive process, specifically, in the duodenum. Certain vitamins, A, D, E, and K will be impacted, and in the ileum, where primarily vitamin B12 is absorbed, that will also be impacted. And the arrow here down towards the center is the duodenum. And the arrow here on the right is pointed specifically toward the ileum, so we can get a better understanding of where that's located anatomically. This is just a brief overview of the CDC provided for how that Ascaris, that roundworm, affects the body and its bodily system. So we pick it up, basically it's through rodent feces. We inhale it. You can see the whole process of how it's ingested, and the larvae begin to kind of re-enter into our GI tract, and that's where everything begins in terms of the infection and presentation of symptoms. So the effects of protein malnutrition, also a secondary diagnosis, that can impact various aspects of the body. As you can see, there is a reduced body weight that can happen. There's muscle wasting, decreased strength, skin thinning, edema can develop, immunodeficiency. It impacts multiple systems, as you can see here: the integumentary, respiratory, musculoskeletal, and circulatory system. Thank you guys so much for listening today. I hope you all have a wonderful rest of your day.